Hi folks, welcome to Dr. Crew Review. I'm Dr. Alex Keller, and I'm here with my colleague, Dr. Lucille, and we're going to talk about SIBO today, small intestine bacterial overgrowth, and the products that you can use to treat SIBO. So, Dr. Holly?
Yes, sir.
Where do you want to start with SIBO? Can you maybe take us through what is small intestinal bacterial overgrowth?
Right. So when I think about SIBO, so small intestinal bacterial overgrowth, or actually SIFO, small intestinal fungal overgrowth, I kind of think about real estate in a way, right? Location, location, location. So where do we want those bugs? Not in our small intestines. We want them in our large intestines. And when they start to colonize in the small intestines, people are very uncomfortable. Right. You know, what I see in my practice when I'm suspecting SIBO is really the big thing is constant bloating, stomach distension, abdominal pain. But you can see things like nutrient deficiency, osteoporosis, hypochlorhydria. If I do a stool test, I'll usually see high fecal fats, products of protein breakdown in the stool as well. So that kind of keys me off that something's going on.
Yeah, so any digestive symptoms in general could be SIBO or SIFO.
Yeah.
But what's become kind of confusing is that there's so many other situations that can cause those kinds of symptoms as
Exactly. They're overlapping for sure.
Exactly. So what kind of testing would you typically do?
Yeah, it's a good question. You know, I graduated from Naturopathic Medical College in Southwest College of Naturopathic Medicine in 2001. And back then, we weren't talking about it. It has just been like in the last decade that we actually know that this exists. And so the testing that I use mostly is breath testing. So because of the fermentation of those bacteria, and we do a breath test, 2 or 3 hours. I usually run the 3 hours. If you've got an increase in methane or hydrogen, in those first 2 hours, it's usually indicative of some aspect of small intestinal bowel overgrowth.
Right, because early on in the digestive tract, when the fermentation is happening, then those gases are released, and you have the two different types of bacteria or fungus that can release those kinds of gases.
I always, when I'm talking to my patients, one of the things I say is I'm trying to help them understand what's going on is like we breathe in oxygen, what do we breathe out, right? A waste product, a carbon dioxide. And this is exactly what we're trying to measure when those little guys have their, respiratory
fermentation.
Yes, and so they kind of get it then, and it's not supposed to be there.
Exactly.
Yeah.
So in treating SIBO, what we usually use is some form of 4R, 5R type program.
Right.
Walk me through that.
So many manufacturing companies have this set up, and I've seen it in many variations. There's 3 Rs, 4 Rs, sometimes up to 7 Rs.
Right.
But we're thinking about just the concept of the gut, and the first R, most important, remove, okay? So removing, we gotta stop feeding first. And so a dietary intervention with SIBO is very important. There's FODMAP, there's the specific carbohydrate diet that's been very popular. There's a SIBO safe diet that's out there that I know about, but there's also the physician's elemental diet. This is by Integrative Therapeutics. Now this is what I use a lot if patients are willing, because this is a meal replacement, usually 2 to 3 weeks, and you dose based on caloric need. And this is something that is able to actually feed and nourish the body and starve the bacteria. And that's what we need to do to get on this process, because it's very difficult to treat. It can be very, very difficult to treat. So removing with a dietary intervention first. Then, yes, there are antibiotics available, but there are also herbal antimicrobials. Priority 1 has SIBOtic, right? So a nice combination formula, blend garlic, berberine, caprylic acid, oregano leaf. And then Biobotanical Research has their own 4R program, and this is something that I use all the time, especially in children, if there is a degree of dysbiosis, because it's liquid and you can taper it. If you're starting to have somewhat of a die-off reaction, it's easy to slow down. And they also have capsules with the biocidin. And then, of course, the aloe verix here, continuing to remove and also encouraging detoxification as we're removing. So that's the first R. I would say the second R across the board is something like replace. What are you going to replace? Any nutrients that might have been deficient in the process because of the condition. Any digestive enzymes that they were lacking that kind of contributed to getting this condition in the first place. Second R. Third R, re-inoculate. Now, this is a little controversial. I know that probiotics, especially probiotics that contain prebiotics, are contraindicated in somebody with SIBO because they can feed the bacteria and the patient gets worse. But there are a couple ones. Saccharomyces boulardii, really important, doesn't have prebiotics, so I use this quite a bit. And then the bifidobacteria infantis, from Lactoprime Plus, Claire Labs, wonderful for abdominal distension, abdominal pain. So those are two sort of SIBO safe things that I use all the time when we're looking at that third R of reinoculate. And I would say that fourth R, repair. You know there's a degree of hyperpermeability, leaky gut, once again, because of it, and maybe a cause of it, so contributing factor as well. And so zinc carnosine, wonderful for repairing the gut barrier. And then we think about things like glutamine, which you can find, of course, out there all the time in a powder form. Integrative Therapeutics has the glutamine forte, which has that curcumin in there, wonderful for any GI inflammation. And then, of course, glutamine being the preferred fuel source for the enterocyte. So we're going to heal that up. So it is definitely a multi-pronged approach, sometimes difficult to treat, definitely on the rise because I think we know about it more and we're able to test. And with good clinical acumen, we can sort of single in on that diagnosis and get the job done.
Fantastic. So you've given us the entire overview, which is essentially determine what you're dealing with through breath testing, and then apply some derivative of the 4 or 5R program, which is remove, replace, repair, reinoculate, or some variation.
Sure.
So different types of practitioners may change that up, and you may change it up based on what you're dealing with.
Right. Every case obviously is still individual.
Exactly.
Yeah.
So is there anything else that you would do?
I would say what's really important, getting rid of SIBO is one thing. Helping the patient not have it come back is another one. Right. And I think this is a really important point because I've seen it so many times. So, during this treatment, yes, removing, very, very important, getting all of that stuff in. And then at the end, using dietary interventions. So that 5-hour, eating every 5th hour, like 4 or 5 hours, and then having a good 12-hour fast, along with using prokinetics. Like Priority 1 has their SIBO MMC, that migrating motor complex. So keeping gastric motility going, getting that autophagy there so the cells are cleaning out and you can just decrease your chances of SIBO returning. So those are really important interventions at the end. So prevention is the cure.
And that is such an important part that people don't often realize is that SIBO, due to the vagal connection between the gut and the brain, can very much be...
Or the gut and the brain.
The gut and the brain.
The gut and the brain.
The brain and the gut. Can very much be a factor when you're dealing with the migrating motor complex, where if you have stress, if you have any psychological issue or brain issue, that it can directly affect that MMC. And then you can have the passage of bacteria coming up from the large intestine as well.
Yeah, and that's why, I have seen adaptogens being used. Biobotanical does have an adaptogen formula that kind of fits in here as well. And I think that's exactly for that case.
Exactly. Yeah. Awesome. Thank you, Dr. Holly. And thank you for tuning in to this episode of the Dr. Kerr Review. Check in next time and we'll talk about more products in our industry.